Inflammation causes the majority of gallbladder diseases due to irritation of the gallbladder walls, which is known as cholecystitis. This inflammation is often due to gallstones blocking the ducts leading to the small intestine and causing bile to build up. It may eventually lead to tissue destruction or gangrene. Cholecystitis can either present itself as acute cholecystitis or chronic cholecystitis. Acute cholecystitis is generally caused by gallstones and may also be the result of tumors or other illnesses. It may present with pain in the upper right side or upper middle part of the abdomen. Acute cholecystitis can also cause fever, nausea, and vomiting. After several attacks of acute cholecystitis, the gallbladder can shrink and lose its ability to store and release bile. Abdominal pain, nausea, and vomiting may occur. Surgery is often the needed treatment for chronic cholecystitis. Complications of gallbladder disease can include obstruction of the intestine because bile is not present to help digest lipids. Long-term inflammation of the gallbladder can cause scarring and perforation. This condition can then develop canceration of the gallbladder. Kidneys are the organs that filter waste products from the blood. They are also involved in regulating blood pressure, electrolyte balance, and red blood cell production in the body. Kidney failure occurs when the kidney loses its ability to filter waste from the blood sufficiently. Factors such as toxic exposure to environmental pollutants or certain medications can interfere with the function of the kidneys. Certain acute and chronic diseases can also lead to kidney failure. Symptoms of kidney failure are due to the buildup of waste products and excess fluid in the body that may cause weakness, shortness of breath, swelling, and confusion. Kidney failure has a multi-system effect, which hurts the body on many different levels. Damaged kidneys can result in anemia and iron deficiency. Kidney failure also raises the risk of cardiovascular diseases. High levels of urea in the blood may also cause gastrointestinal problems. Urinary retention is the abnormal holding of urine in the bladder. Acute urinary retention is the sudden inability to urinate, causing pain and discomfort. Causes can include an obstruction in the urinary system, stress, or neurological problems. Chronic urinary retention refers to the persistent presence of urine left in the bladder after urinating. Common causes of chronic urinary retention are bladder muscle failure, nerve damage, or obstructions in the urinary tract. Developing urinary retention means abnormal urine flow, which gives bacteria at the opening of the urethra a chance to infect the urinary tract. If the bladder is stretched too far for extended periods, the muscles may become permanently damaged and lose their ability to properly contract. Sometimes, urinary retention can cause urine to flow back into the kidneys. This is called reflux and can cause damage or scar the kidneys. Intestinal failure occurs when the intestines cannot digest food or absorb the liquids, electrolyte, and nutrients properly. Intestinal failure is often caused by short bowel syndrome or by digestive disorders such as Crohn's disease, which causes the bowel to malfunction. Symptoms include bloating, diarrhea, fatigue and weakness, poor appetite, weight loss, and vomiting. Many complications of intestinal failure are gastrointestinal issues due to poor absorption in the intestine. Examples include malnutrition, dehydration, vitamin, electrolyte, and mineral deficiencies. Intestinal failure may also cause liver disease, kidney stones, or gallstones due to poor absorption of calcium or bile.